We're pleased to welcome Natalie Leek, who brings with her, I'm sorry, Natalie, but decades of experience in changing the face of Cleveland. She wears many, many hats: teacher, marketing professional, director of admissions, director of development, e-commerce director, CEO of nonprofit. Her role of CEO of nonprofit of Providence House began almost 20 years ago, hard to believe, in 2001. And she will tell you that since that time, she has probably had 5 different CEO roles as the organization has taken on new phases and adapted to meet the changing needs of the community. Her first capital campaign took place in 2012, and if you ventured onto their campus, it truly is a campus on the edge of Ohio City. It was a significant and much needed expansion of the crisis nursery. Her current capital campaign to expand their much needed services is on the east side in the Buckeye Shaker neighborhood. Her leadership has made Providence House a national model in preventing child abuse and neglect and preserving families. She has pivoted to make a revenue-generating module in digital consultation regarding crisis nurseries. She leverages her extensive network, part of which is represented in her Leadership Cleveland 2010 class on this call, to do the best that she can in reunifying families. In addition to doing all of this, I understand that she wields a mean home maintenance tool and is a talented home renovator. She reads 3 to 4 books a week, and she will tell you that the most important quality a leader can have is one of tenacity. And tenacity is what is needed not only at Providence House, but as the mother of 2 active teenage boys and as a foster mom. Natalie, thank you very much for joining us today, and I will turn it over to you.
Thank you, Mary Ann. I know I hear 20 years at Providence House, and I know I see Ed Bell on the call, who was the board chair that hired me. I wonder if he's sitting there thinking, oh my gosh, what did I unleash? But so for those of you, just a little background. I know today is about pivoting in a pandemic and how we had to very rapidly transform our services. So just to give you a little background on our service model, if you're not familiar, we are truly an on-site service. We provide emergency residential shelter to children birth through 12 years old who are living in a crisis, which places them at risk of abuse and neglect. Prior to the pandemic, children lived on our campus for up to 90 days. Parents came to our campus for case management, counseling, parenting, education. So we were a very campus-focused service. We did not really branch out to community or do much virtually. Some of that through regulatory restriction for our licensing, which we can talk about how child welfare has also had to pivot during this pandemic, with parents unable to access children in foster care for visitation, as an example. So we determined, initially we thought we would try to stay open with the children's shelter program. As we started to see what was happening in residential programs like nursing homes and other congregate living environments, we became very concerned, not only for the safety of our staff and children, but for the families that were coming to visit with their children. We made the decision in middle of March to temporarily close our children's shelter program. We really were not prepared to understand all the nuances of quarantining children in a group living environment. We hadn't quite figured out how would we have parents still access services. And so we made the decision to safely discharge children that were in our care. A lot of public policy work supported this in eviction prevention programs, in the prevention of utility shutoffs. We were able to keep families in housing situations that were safe and stable. And a lot of that was a result of trying to keep families sheltered safely through public policy change, which we were advocating for among other nonprofits. What we did actually in our pivot is not only continue to support the families we serve, the families who had children in our care, families calling for shelter that we needed to support during our temporary closure, and also families in the community that were now getting referred to us in droves by our nonprofit partners. So we flipped to a completely virtual, remote model. Our service sort of went out in two different ways. For families that were receiving education, case management, counseling, we immediately went to phone-based and now visual, so through Zoom, went through the process to set up telehealth, trained all of our social workers on telehealth protocols, and again, through advocacy with other child welfare nonprofits, changed the regulations in the state of Ohio to allow Zoom, there's a HIPAA version of Zoom, to allow Zoom to be used for family visitation, case management, education, and counseling. So there's a lot of public policy and advocacy work we had to engage with other nonprofit partners to become a little bit more flexible than the state had previously allowed us to do. What we're excited about is with those virtual services, even as we reopen, and we will be reopening the shelter next Monday. I'll talk to you a little bit about that harrowing experience, but we will continue to provide these virtual supports. Since the beginning of the pandemic, we have now supported nearly 300 families virtually or through home-based delivery of food, baby items, formula, cribs, you name it. They're calling us and they're saying, we need this. I can't survive in my house. I don't have enough food. I don't have these items for my kids. So our social workers and teams are literally loading up our vans and driving out into the community and delivering door to door so that families don't lose the ability to keep their kids safe and fed and taken care of. We do anticipate, we sort of see this as innovation for our program. We've talked about home visiting. We've talked about virtual service delivery. Many of our parents are inpatient in drug treatment, mental health, psychiatric inpatient, receiving medical services, or they're incarcerated for short periods of time. They have been unable to get our services on the parent side of our work. In the past, we've talked about how we did it. This forced us to do it. And now it's become such an important part of our work to access isolated parents and families and community with no transportation. It will become now the future of our service model. We will still do on-site as it's safe. We will still do community-based work with our community partners where we're bringing social workers in to work with parents and grandparents. But much of our work now, especially in these times as we see the rates continue to increase, is going to be virtual and will remain a part of our service model. We are reopening, as I said, next Monday. We thought we would do it a little bit earlier, but regulations are changing constantly. So in communication with the City Department of Health, the Cuyahoga County Board of Health, the state of Ohio, our licensing entities, and Metro Health, our medical partner, we have really waited until we felt we were completely buttoned up. We knew that every child who entered our building could be tested. We could safely isolate them so we didn't spread infection unknowingly, how we would quarantine ill children. We do anticipate we will have children who are going to be COVID positive, and we can't just take them in and then discharge them out if the parents have nowhere for them to go. So we are opening both facilities on our campus. One will be our normal, healthy kids, if you will, in the group setting. The other will be our quarantine unit. So all intakes will happen there. Those kids will be isolated, but in a playroom with caregivers while we await the test results in 3 to 5 hours. And then if they are COVID infected, they will go into a quarantine unit. And when I say unit, it's still bedrooms and playrooms and a kitchen and all of that, but they will be on a separate HVAC system in a separate wing across the street from other children to reduce the chance that we could inadvertently have one child infect another child. You can imagine the PPE requirements for this are out of this world, not the norm that we would expect. So face shields, masks, gowns, gloves, So it's transformed the way that we are going to deliver care for kids for at least the next 6 months. This will be the protocol. It may go longer than that. We're going to see what happens. You know, we're already spiking. They're forecasting a second spike this fall. And our goal is to remain as open as possible. We have a number of our board members on the call, and people who know us well. It's been, our board's been amazing. We're doing bi-weekly calls with executive and finance. The board has stayed engaged and informed, and we're communicating to the community widely through social media with video updates and just constant communication so that people know where we're at with things. So that's sort of how it's going. So the silver lining of it is it forced us to innovate and pivot in a way that we thought about. Now we're actually doing it and realizing that it's actually going to improve and expand our ability to deliver service beyond just children's shelter. So we're super excited about it. And that's my pivot. Lots of other pivoting going on, but I think it's important for people to know how much policy work is behind this, how much planning is behind this. Our teams are there right now doing active drills this week to get ready. So, you know, knowing how we screen, how we test, how they gown up and mask up, and what to do if there's an identified case in the facility. So we're making sure we're doing this as safely as possible.
Well, Natalie, we can move to questions from the attendees. So for anyone on the call, if you have a question, pop it in the chat box. And to kick off the conversation, what have been some of the most cited needs from your constituents during the pandemic experience thus far? And how have you worked to overcome those?
You know, what we've seen, and this is from our partner agencies, the referrals we're getting for basic need items, I think that there's this sense that, yes, we've got food bank out there working their tail off. We've got all these food pantries distributing. But if you're a family with young children, access to those children's items, diapers, formula, children's medication like baby Tylenol, stuff like that, it's not available. In the case of families that might have, we call it SNAP, you might remember food stamps in the vernacular, you can't buy diapers with those. So even if they're getting additional assistance through the CARES Act, there are products they can't source. And so it's those really basic items. Families don't have transportation, so even getting to the grocery store and then even having the income to purchase items that aren't eligible through their SNAP. And then just the limitations of our local food distribution system in terms of children's products, you know, like I said, baby food formula, diapers, wipes, things like that. So of the almost 300 families that we've served, nearly 150, 175 of those were community referrals from other partner nonprofits saying, I got a mom and she has no formula. So we've been doing a ton of that work, and that work will continue.
You mentioned the need for PPE, and where do you stand on acquiring what you need in terms of that PPE?
PPE has been probably the biggest challenges and one of the biggest slowdowns. You know, the guidances, N95 masks and, you know, all of this. And now we're hearing, well, KN95s are okay because you can't get anything else anywhere. You know, a shout out to Oswald companies who heard and, you know, donated, you know, 300 masks first round, got us 200 more. But you think about how many times those masks are coming on and off, and, you know, the gowns coming on and off. So we're talking about, you know, literally the need for hundreds. We do not have enough children's masks. I think we only have like 30. Kids under 3 can't wear them, shouldn't wear them, just for their own safe breathing. But, you know, for our bigger kids, and we go up to the age of 12, you know, we don't have enough children's masks. That's a real gap, and they're hard to find. We've got some groups that are sewing them now for us, but it's just going to be a face covering. It won't be a rated mask at this point. We just can't find them anywhere.
So for those older students that are with you and looking ahead to going back to school, whether that's virtual, or not. What
Right.
type of support, or how do you plan to help address that or support the students who might need a virtual education, or how might that impact working with those students?
Yeah, and so that is definitely a concern for us. We are queued up. One of our support grants from actually the COVID Relief Fund through the Cleveland Foundation allowed us to purchase some student Chromebooks so that we can make sure that if school is virtual, we've got enough on site and they're queued up to our network so that those students can do virtual work. We do have a number of not only childcare staff, but some of our volunteers who do have education backgrounds. And so they're partnering up to make sure those students are staying on track. So if it's virtual, that's our plan. If they go back to school, and districts are all doing it differently. So it could be a few days a week. It could be 5 days a week. It could be half a day. So we're waiting to hear what's happening with that guidance. And we serve over 30 zip codes in Cuyahoga County. So we're not just talking about figuring out CMSD. Every single district we touch, we're going to have to understand what their protocols and requirements for attendance, online learning, all of that. And we do act on behalf of the parent. Parents do, when they admit children, we're not only getting medical releases and all of that, we're also getting access to school. So we work very, very closely with our school systems and would anticipate that that's how it will go, whether they're on site or not.
So, as you think about working with the families and the children over these past few weeks, what have been some of the emotional or psychological impact that you've seen of experiencing a pandemic and what we've all had to kind of go through over the past few weeks?
Yeah, and I'll answer it from two fronts. On the staff side, it's been challenging. It's been tough. Administrative, fundraising staff, social work staff are all working remote. We're connecting through Zoom. We're connecting through Microsoft Teams. A few of us are in and out of the office, but very limited and staggered so that we can deal with hard copy and, making deposits and things like that. So we're trying, we've done a good job, I think, of connecting as a team, continuing to, we had a virtual baby shower, wedding shower on Friday together with mocktails and, just trying to continue that sense of connectedness. I think the most difficult team members for us are childcare. Because of our licensing, laying them off puts them in a new hire position. So we'd have to rescreen, just craziness. We did get a PPP loan and we have been able to pay them throughout, but they're going crazy saying, you guys are all working, you're working so hard, you're changing all the protocols and service delivery. What can we do? So they've been helping reset the rooms, sanitize the building, put away inventory, just get us ready to reopen. And they're actually really anxious. They're cautious, but they're anxious to be working with the kids again. They know how many kids are out there in very unsafe situations, and their risk of exposure just increases. Many of them are homeless or in really, really bad situations. On the family side, it's been incredible. We had one of the moms, when we did one of our first home deliveries, she said, of course, Providence House figured out how to get to us. Because that's what we do. We meet our families where they're at. We have to pivot. We have to respond to changing, epidemics in our community. So lead paint, what do we do now? How do we serve those kids? The pandemic introduced a lot of new challenges to us, but our families feel really supported. We're checking in. They're chomping at the bit. A lot of you probably have kids at home yourselves. You're trying to work. You're trying to manage. Hopefully we all have the resources we need. We're talking about parents with no resources. Calling, at first it was food and diapers and formula, and then it was like, do you have some books and crayons and toys or something I can do with these kids? So we've been doing a lot of toy distribution, things like that. So it's been a strengthening experience for our organization. And it's been an affirming experience that, we know what we're doing. We've got this. I had a few of our board members say, you guys are pivoting faster than my own corporation in responding to this, changing what you need to do, keeping us informed. And so, that's that tenacity that Mary Ann talked about, and agility. And I think our nonprofits have been incredible through this pandemic, just reinventing and, you know, moving services out any way that they can get them out there.
So you had been working towards an expansion for services on the east side.
Yeah.
Where is
campaign?
So where are the plans? What's the status of that expansion?
So we, with help from another CLC, a fellow alum, Tim Tramble, who I know did a lunch last week or the week before. He was with Burton Carr. He and Cleveland Neighborhood Progress knew that, you know, while we're serving about 350 kids a year on our West Side campus, last year 458 kids did not get in. They were waitlisted or unserved, and 70% of them live in East Side zip codes near or around Buckeye Shaker, Kinsman, Huff, Woodland, in that area. So as we knew it was time to expand, but in reflecting on this strategically with our board, we have to go where the kids are. Transportation is a huge issue for families. Access is a huge issue for families. And these are forgotten neighborhoods. These are our redlined neighborhoods. The service gap on the east side, as we went over there and said, who are our partners over here? Who can we work with? Who do we refer to? There's nobody over there. The vacuum of services and support is astounding. So we did purchase a building at 118th and Buckeye. Our campaign is $13 million. 8 of that is capital to renovate the existing structure. This is a building, if anybody remembers when Beachbrook was in it, so big old historic bank building. It includes renovation of that and then the construction of a 20-bed residential crisis nursery on the back side of the building going down 118. With incredible support through New Market tax credits. The Cleveland Foundation awarded an amazing recoverable grant of $1.5 million. Our foundation community, Mount Sinai, Cleveland Foundation, St. Luke's was our first investor. We are now at about 8.5 million of our 13 million goal. It's going to be, that last stretch is always the hardest. It's really going to be tough now. We've seen a 20% reduction in philanthropy through COVID, primarily through individuals and corporations. Recovery is going to be a while. And so we're, you know, being very planful in how we phase this. We've paused breaking ground on the new construction until next spring, so we can kind of see how this plays out. But we have completed renovation of the East Side building. And in fact, Tim's former organization, Burton Carr, is one of our first tenants. So we've got the Buckeye team from BBC will be working alongside us in that building. Our primary administrative headquarters will become the Buckeye site. So the return to work and staggering people becomes much more easy when we've got this massive building with lots of separate offices. So that is a part of our return to work strategy for our administrative team and some of our social workers who will focus on the East Side community. So we're forging ahead. The building's finished. We're returning people to those offices.
Providence House has always been a favorite volunteer space for many of those in our community. And a question came in of, will you have, and if so, what, volunteer projects for people to support you during times of social distancing and your reopening?
Yeah. Yes, we do, and we have them, and you can go through Rachel to get to me or go to our website. As we are reopening, right now we are limiting volunteers on the child care floor. There's so much training around the PPE and the protocols. We do have a few volunteers with nursing background that might come back sooner, but we're working through that. However, from a community volunteer perspective, we are bringing in teams and safely spacing them to help count and sort donated inventory, to help with landscaping on both campuses. We have a donated warehouse that we've got to move out of at the end of the month. So we're looking for folks that are willing to come in safe teams. We'll provide PPE to help us pack and empty that warehouse out. So there are lots of opportunities right now. We're looking for groups, probably with the safe distancing, 10 to 12 would be the max group size. We can work with smaller teams too, but lots to do, lots to do.
And along those lines, as we head towards our last question here, outside of volunteering, what else can our community do to help support you and the work of Providence House?
You know, people always, you know, of course, are going to assume I'm saying, go to our website and make a gift. And, you know, a lot of you will see an email and social from me for our reopening day of giving. That's the 15th of this week. Really, though, the thing that is the most important is all of us have to keep an eye on our kids. And through the pandemic, because there's no eyeballs on our kids with daycares and schools closed and all this, there has been a 60% reduction in the reports of abuse and neglect in Cuyahoga County, and we are #1 in the state of Ohio. So you think about all those kids that we don't even know are unsafe right now. Tell people about us. Tell them that we're there, that it's free, that we don't take their kids away. Our goal is to keep their kids safe and keep their family together and connect them to all these amazing nonprofit partners we have who can bring their family back together, get them through the really challenging issues of homelessness and addiction and violence. And, you know, we are really blessed in this community to have over 120 partners that we work with to stabilize families. But a lot of people still don't know about us, or they fear coming for help. And this is a safe place. This is a safe place where kids and families are our #1 priority.
Well, Natalie, thank you so much for sharing the work of your team at Providence House. And we wish you the absolute best as you head towards your reopening. And we will be sure to share the Providence House website in our follow-up email so that all attendees today can share the information with their networks as well as follow up and become involved. So again, thank you for sharing all that you do today. And
Anything
turn it back to Mary Ann.
Thanks, Rachel. Thanks so much, Natalie. I mean, your passion just comes right through via the Zoom, and not having you in person doesn't in any way inhibit it, how strongly you feel about your work. So thank you for sharing all of that with us.